research and the preventive programs in Australia. And as you probably know, Australia is nowadays the country of focus in which most of the impact of HPV vaccines will be shown first. And most of the adaptations of the screening program when the vaccinated cohorts reach screening age will also be seen first, together with some other regions in the northern part of Europe. So Suzanne will speak about the evidence-based policy in HPV vaccination, and most certainly will open the scope of what we know today, realizing that indications, they are perhaps 5 to 6 years behind scientific information. So we have the projects, we have the results, then we have the licensing, then we have the recommendations, and then we have the public health approach. And we are still living in the sort of information that we had 6, 7 years ago. We are still living on women first, cervix only, adolescent girls vaccination. And we are now moving very rapidly, but with some lag, into both genders are affected, many different cancers are. It's not only cervix, and it's not only females, and it's not only adolescents, because we've shown that the vaccines are able to operate in many other age groups. So Susan will address that point. Then we have Carlos Santos, which is a gynecology-oncology professional who's been leading the Peruvian efforts for cervical cancer control, again, from the region and in one of the countries where cervical cancer is indeed one of the major cancers in females. And he will discuss a completely new opportunity, which is the use of the highly sophisticated HPV screening technology adapted to low-resource countries. And finally, we have Mark Arbin from Belgium. Mark has been one of the persons that has led the international efforts to summarize the literature. This is something that it is not easy to do, and it is not easy to do it in a consistently and methodological sound way. But he's been putting together major international reviews on screening, HPV strategies, combination of screening and vaccination, modeling alternatives. And he will discuss how, in the light of the current knowledge, we can address cervical cancer prevention in developed countries.